right. Since you actually, you know, went a little bit into the neurological aspect, so my question is, physical brain development differs with the progression of age. Is this an important aspect of how children, in comparison to young adults, recover?
Yes, this is there are at least three parts of the brain that are going to be important, and in fact, this also raises the specter of the whole. Our field is revisiting attachment theory. One of the things that we know is that the hypothalamus, the amygdala, and the right preorbital frontal lobe, this area is going to be important for self-soothing. So if you actually have, in the first year of life, let's say a parent is very supportive of the kid and is able to sort of settle the kid down because they themselves can settle down, then you actually have a child who will developmentally be able to self-soothe during periods of stress. If you have any kind of trauma that occurs earlier on, the trauma at that point would be a parent-child relationship. The parent is either depressed, anxious, unable to soothe themselves, gets overwhelmed, then you actually have a loosening of that area. So that would be the first sort of area that you would be concerned about in the brain. The other part that's important is the corpus callosum. It's the band of fibers that connects the two hemispheres together. Traumatized children actually seem to have smaller corpus callosum. The earlier the trauma, the smaller the corpus callosum. Why is that important? It's because in some ways the child is really dealing with an overwhelming piece to their brain, or to their if they're experiencing stress, they're literally the hemispheres are operating independently of each other, not communicating. So they're operating on half a brain. That would be these the concerns, and that's what you see with borderline people. Okay? There was a historical connection between borderline personality disorder and sexual trauma, and we discovered that in fact borderline people probably born in borderline families. It's PTSD, which then triggers the third neurological area, which is the HPA axis. John Breer talked about that, the hypothalamus pituitary adrenal system. And that's the area that's basically responsible for your fight-flight reaction. And in fact, most people, when the fight-flight, fright, system, the HPA system is connected up well, if a crisis comes, they sort of have this reaction. When the crisis is gone, they regulate, they go back to sort of pre-crisis. When your HPA axis is dysregulated, when a stress comes, it goes like this, and the stress disappears. It just keeps going, and it explains a lot of the sort of dissociation, flashbacks, escalation, inability to self-soothe. So you have several areas of the brain that are critical in development, and also how they respond. And there's also a small body of research that shows that a parent's propensity in PTSD can also be passed on. They looked at children of parents who went through a war trauma, and in fact, the children seem to have acquired sort of a hypervigilance to PTSD. So you were actually talking about a pretty complex, set of ideas that we're. I don't know if we're in the infancy, but we still have a long ways to go on that. And then you got medications like Inderol that's affecting, how we affect trauma memories. Then you bring in, legal, sort of aspects. You're gonna sue a church because you think something happened. Then you definitely don't want any medication to be given to patients that will affect their memory. So it's quite complex. Okay, but we know that there are brain areas that are affected, and the earlier the trauma, okay, the greater probably the brain. I hesitate to say damage, but it would follow a different course of development. Sadly, our diagnostic system, the DSM-4-TR, does not make a distinction of understanding those kinds of differences. We'll note it whether the kid was abused as a child or adolescence. And I'm hoping that by the DSM-5 that change is at least made, because I think that the younger the kids, they're gonna need more intensive intervention, because you want to prevent the kind of complex trauma. The complex trauma is when you're abused as a child, it sets you up to be abused as an adolescent, it set you up to be abused as an adult. And again, the body of literature out there right now that looks at the evidence-based treatments for sexual abuse, they look at simple traumas. Meaning that one-shot deal, and they get the CBT kinds of approaches. And the folks who are complex trauma, which are the larger folks the larger percentage of people that we see in clinical settings, are not included in that research. So we have sort of a catch-22.
Are there any repercussions of sexual trauma affecting their ability to learn and interact with others in school?
Oh yeah, there's actually a body of literature that's looking at PTSD and ADHD. That PTSD, post-traumatic stress disorder, in the academic setting gets misdiagnosed as ADD or ADHD. And what happens is that the kid gets misdiagnosed, they get put on ADD medication, which basically are stimulants. It kicks off their anxiety, they end up getting Alzheimer's. So you have to make a clear distinction. Here's at least the one distinction that I make between ADD and PTSD. The kid who's PTSD is miserable. The kid who's ADHD, everybody around them is miserable. Okay? And you have to make an accurate diagnosis. But yes, it also affects, affects their learning. Just, it looks like learning disabilities. Because the kid is so self-absorbed, they're not really, little Johnny doesn't care what 2 plus 2 equals, because at home they're being abused. Understand that? And if kids are also aware of abuse going on at home, to siblings, or even violence at home, they get the same kind of thing. There's a program in Cambridge Hospital, the Victims of Violence program, and that's one of the main things, is that you have kids who are looking like they are learning disabled, that they're anxious, that they're depressed, or whatever, right? And even, looking paranoid in some way, not feeling safe in their way, later on